Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus a lot on acne, on scars, on pigmentation. I also do a lot with skin restoration. And I want to actually just keep this today as pretty informal and just kind of go through everything that I do, and then also things that potentially I had some questions of that a lot of people really wanted to know, particularly with regards to lasers, what kind of devices I use. And so I'll kind of walk you through just my thought process with lasers and energy devices when it comes to skin restoration, when it comes to scars, and why I think that we have to use multiple different modalities and not just lasers and energy devices. So I had one question that popped up on my feed, and I promise I'll talk about it a little bit tonight. Someone was asking about radiofrequency microneedling for scars. They were saying that they were told that 4 to 6 sessions would give them 70 to 80% improvement if they did a form of radiofrequency microneedling. And apparently it was ice pick scars for this patient, or for this person that asked the question. So when it comes to scars, I really do find that radiofrequency microneedling is going to be pretty ineffective for the vast majority of scars, and in particular for ice pick scars. The reason why is that really with those kind of scars, we want to be really focused. We want a little bit of acid a lot of times to stimulate collagen at the base of the scar. Sometimes we may have to actually manually take out the scar. But the problem is that with radiofrequency microneedling, you may have to use too much heat, too much energy, and then that could potentially lead to problems and complications like fat loss. So I definitely do not recommend it for certain parts of the face. If there's like skin tightening issues that you want to do, if you like basically have some laxity, then yeah, that's a different story. So we could do that potentially for tightening. Let's say your scars, you had rolling scars and you were constantly stretching out your skin. And then sure, we could do some radiofrequency microneedling, sometimes combined with subcision to get a little bit of skin tightening. But anybody who's promising, 70, 80, sometimes even 90% improvement with anything is suspect. And then particularly with something like radiofrequency microneedling, which, is not the right modality, not the right kind of tool for scars. And when you're using too much heat like that, you could end up causing more complications. You could end up having patients lose fat, which actually makes the scars look worse. So, be mindful of that. Just pay attention of anybody trying to sell you these packages and saying that you should be doing this for your scars. I had so many questions of people that were saying that, I thought radiofrequency microneedling would help. And I think it's really a pretty poor modality. In fact, I was sort of, I would sort of think that, microneedling by itself may be even just better than radiofrequency microneedling, and microneedling may be a little bit less expensive. No, yeah, I just put down I'm a skin restoration. Oh, I should say skin restoration specialist. Thank you for putting that to my attention. That's what happens when you try to do this at the last moment there. So I'll fix that there. But yeah, so I definitely wanted to go through just the different common questions that I had. And over the course of the week, I said, listen, I'll talk to you guys over on the live and I'll try to help you out with answering some of these things. But I'm here right now, hopefully you could ask me it as well right now, but I'll kind of go through some of the ones that I got on IG, on TikTok. And I think it's probably worth really going through a lot of the ones that we just get over and over and over again. One of the other ones I always get asked is, well, what kind of laser is the best for scars? What CO2 brand is the best for scars? So it really doesn't matter, really. I saw multiple questions that were basically asking about the different brands that we use, or what brand that they were recommended, and whether that's going to be effective. It's not about the brand for the laser. The way I do the laser, though, is really pinpoint with basically like a surgical tool to help smooth down certain edges of the scar. And that's very different from a lot of places. You'll see like whole videos of me that are on different platforms and just going back and forth on certain scars, just the edges of the scars. And I'm using a surgical form of the CO2 laser to do that. So unless they're doing it that way, I don't think that really necessarily matters, what tool they're using. And I could use almost any CO2 laser that has a surgical handpiece for that. So it's really not about the particular tool. And I have sometimes, there's these doctors that sometimes will try to tell me to use one type of device or another device. And sure, I'm sure the devices are really good. I'm not like down saying that they're not great, but it's like, it's not about the device really. It's like, a lot of times they're bought by the companies, or they're like salespeople for the companies. And that's why they're acting like this device is the solution for these things. It's just, I've used so many different devices in my course of career. And like, I found that, yes, I like certain ergonomics for some things like that, but I could easily interchange that. Hi, Ari. Thanks so much. Which laser is best for Fitzpatrick 4 to 6? Jamie's asking that. What is the skin condition? If it's more for pigmentation, then I would recommend more like the Pico laser. That'd probably be the best option really for that. Pico laser is probably the best option there. But if it's more for lasers, then Erbium laser is probably the best for 4 to 6 because it doesn't overheat the skin, but you can still use a CO2 laser for certain spots. How long have I been doing skin restoration? Really for about 8 years now. So I've done close to 16,000 patients. I got it audited again, but like double check it again, but close to that. And it's, been pretty amazing actually, honestly, like the amount over and over and over, the consistent results that we've been able to provide. When I first was really starting, it was really with more, I wanted to solve pigmentation so that I could do darker skin types when I do lasers and energy devices. And I was talking about, scars a lot, but I also do a lot with just anti-aging in using lasers for that, which a lot of people were saying don't do too. Everybody was just pushing all the time when I was in this industry. People were just pushing and pushing nonstop radiofrequency microneedling, and they're pushing microneedling and darker skin types. 2 of my patients today who I did consultations with were told that the only way to solve their scars were with radiofrequency microneedling or with microneedling, regular microneedling. And they were like, it was just ineffective, hardly did anything for the scars. And it's unfortunate, like that's thousands of dollars that they spend potentially, and just time and energy and just the downtime, all that. And for something that, they had ice pick scars, or they just had rolling scars that needed to be subcised, you need to break up that scar tissue, and nobody did that for them. So it's unfortunate. Renzo, how's it going, Renzo? Renzo saying, hi, Dr. Qazi. Have you dealt with hypertrophic acne scars? My temple has developed hypertrophic bulge after being subcised. And I did 2 cases today of that. It was awesome. I actually also had a patient who I worked on a year ago, and he had very hypertrophic scars, and it's really smooth now. The key for hypertrophic scars was a few things. Basically, you want to make sure that there isn't like this vascular component where it's not really red and irritated. That really would require more like vascular lasers, steroids, to help relax that, and it's potentially a keloid. Whereas other times it's like just hypertrophic scarring, but it's still from friction. Sometimes I see it with men along like the beard area where they use electric razors, and there's a little bit more friction over there. So in those cases, what we do usually is sometimes a little steroid, or sometimes I would just use like a CO2 laser, flatten it out, and then we could use silicone tape there to keep it flat. And that could happen actually on the nose too. One of my patients today, I worked on him to help smooth down his nose for his scars there. And then also it could happen on the chin. Those are like really common areas for hypertrophic scars, I find. And it's really distressing. It's like we talk a lot about the atrophic scars, but those raised scars, hard to cover up for women or men even. And it's really, distressing because it's like, it looks almost like acne for some people. Will think that it's acne, and it's not, it's a scar. You otherwise have clear, smooth skin, and you still have these raised scars that are there. And it's like, this constant reminder, I would say. Does technique matter when doing lasers, or is it a blanket application, and who does it doesn't really matter? Well, watch my videos. I would tell you, I did 2 cases today, and both patients were like, nobody's ever done laser like that before. 2 of my patients, I would say, of the cases I did today, and they were like, they've done lasers before in the past. And pretty much anybody who sees and watches the videos, you can see how I'm doing it. It's very, very different. I'm tracing along the edges of these scars, and I'm using a surgical handpiece to do that. And it's amazing. You can get amazing results that way. Periodic is saying, how many sessions of TCA Cross is required for someone who has a mixed pattern of box scar, ice pick, and rolling scars? So it may not just be TCA Cross for that. Then what you may need to do is TCA Cross for those ice pick scars and backscar scars, and maybe even the rolling scars. But a lot of times you also want to do some subcision or something to give you a little bit of volume there. And so it's probably not going to be just enough for TCA Cross. TCA Cross, though, depending on the depth of your scars, depending on how good your collagen response is, a lot of times it's anywhere between like 4 to 6 sessions of just TCA Cross, though, just to give you an understanding for, especially for those ice pick scars. Is there anything you could do for African Americans that have pitted acne scars? Yeah, absolutely. There's multiple different options. And sometimes what happens is that, people were turned around and told them to do like nonsense stuff, like microneedling, things like that. And sometimes there's more risk with that for those kind of scars, for like those deep ice pick scars. You could actually get wider with some of those modalities. So it's better to go to someone like me who could just go and do some focal energy in some spots and blend it in with like a lighter form of energy elsewhere if we need to do energy, or just do manual things like subcision, excision, TCA Cross. Those are all useful. Sometimes Bellafill, all those things could potentially be useful there. Do you treat dark under eyes and hollowness? Or do you have someone you refer? Yeah, I do that all the time. I mean, it just depends. Like one of my patients today, she's actually was a physician. She had gotten injected a couple of years ago, and she thought that maybe she still had some darkness underneath her eyes. But really, it's, I'm very, very careful with doing it. I told her, you really do have good volume over there. It's just that in some pockets, there's a little bit of hollowness in the inside. And really, that's not going to change too much. But if it's like the true ligament that you have some volume loss, then yes, we could place a little bit of a filler there. But I think what happened was that people were overshooting it. They're putting too much filler in a really tough spot. It was an area that's circular muscle, and it could push filler outside superficially, and then you could run into this area where it just ends up bulging and looking really abnormal. So that's a lot of times I would turn people away for the under eye area. Sometimes we may just do a little bit in the mid cheek to support it, and I mean like a little bit, like down to the bone. And I say that really, I'm emphasizing that because in our area, especially, I'm not sure where all you guys are at, but like in our area, especially the last few years, there used to be like this epidemic where people were just putting tons of filler, like, they're doing it superficial, they're doing it with a cannula, and when people were smiling, it was just really stiff and thick. Mrs. Jones is saying, I was told nothing can be done back in the day when I lived in Chicago. I'm from Chicago. I was told the same thing. So I think it's the same story, honestly. It hasn't really changed much, unfortunately, in Chicago. I have a lot of patients from Chicago still, and I love Chicago. I go back and forth there just to visit family and things. But it's interesting. It's kind of I'm not sure why it hasn't changed with all that. They still tell patients of certain ethnicities that there's just nothing you could do, or like here's like a microneedling package to do, things like that. It's interesting. It's like I'm not sure. I'm not sure why it hasn't. And they're going to dermatologists that say that they specialize in that stuff over there, and that's what they're being told to do, or just like a bunch of Fraxel lasers. Where was I at? Do you have any treatments for dark under eyes like lasers? Yeah, Pico laser works really well for that. Pico lasers work really, really well for the darkness, the actual pigmentation. If it's so basically you could test it. So look at your eyes, you could kind of pull down your eye area there, and you could see if the pigmentation is really going with the skin. It really is true pigmentation. You could look in the mirror and you could double check that for yourself, and then it is likely then true pigmentation. If it is really more that there's just like the discoloration of vessels, then we would usually then use a vascular laser to do that. So like something like XLV could work depending on your skin type. Ziomara Marie, thank you for coming on. Appreciate you coming on. Ziomara Marie, I actually spoke about you a couple days ago with your video. It was really amazing, actually. I really loved your video. And for those who don't know, you should go to her page and see it. It was, it was actually really, really interesting because, first of all, obviously, I appreciate you being honest and open about the fact that you had such severe scars and really were suffering from those scars, and how you were talking about, essentially just the trauma of the scars. I've talked a lot about that. Essentially, we suffer from trauma from the acne part of things, which I think anybody who has acne or really any skin condition can tell you that it really is a true trauma. And it's really it's almost like PTSD afterwards. But then you don't even get to just experience the healing factor or the healing process after you have acne, because then you have scars. And in your case, the very severe scars. and that, cause significant volume loss. It's very difficult to cover up if at all possible. And so something like that, I appreciate it also because I saw like in the comments, just how many people were so supportive, and it was actually amazing. It was really amazing to see because it was like, there's like this awakening now. And I think the way that the platform is now, you could just see that like people are very supportive of these things, and they no longer have this taboo of like not talking about their skin conditions or their concerns or their or things that they're worried about day to day. And I really appreciate it, like, because it's like so many people go through that and they have some scarring and they still go through it. Yours is very, very severe. And it's like, you could just see it. Like, I can't, like, it's just like you suffer. I don't know how old you are or anything like that, but like, I can't even imagine how long you've been suffering from those kind of scars. So anybody who actually, is on the platform, you should go to her profile and see what kind of scars she has. It's very, very severe scars. And it's like, you're not alone, really. And it's like amazing to hear people like talk about that. And yeah, she's saying it's really hard to talk about. And when she's 32 years old, started when I was 8 years old. I'm sorry to hear that. That's and it's shocking too, like that you suffer for that long, really. Yeah, I'm not sure what you tried. You can actually tell me if you could actually let me know, because I'm actually really glad you came on tonight. It's like a lot of people don't recognize that the acne part is like, at this case, Yomara at 8 years old was suffering from acne. And just imagine that. Imagine an 8-year-old suffering acne, which, a lot of my patients say that they're 10 years old, 11 years old, 12 years old. I myself was 12 years old when I started breaking out, 13 years old when it was really cystic and really severe. And it's like, just imagine that, like, throughout your entire development, your childhood development now, you're suffering from something that's like this, these lesions on your face that other people are confused about and think that's because you didn't wash your face well enough. You didn't use, certain topicals. And in my time, it was like, you didn't use, this apricot scrub, which, it was terrible for your skin. And someone's saying like, beef tallow and stuff like that. And it's like, that's the new thing now. It's like all this stuff that everybody's like been pushing. It's like, trust me, people do all these things and it's terrible. It's like you do all that and you're like, imagine a little kid and you're doing all these things. Or if you're like 13 years old and you're doing all these things and you try everything, and then you end up like with severe scarring, and it's really, really tough. I don't know, DMR, were you actually seen by anybody to take care of you with like any medications? They probably were like said that you were too young, and maybe they didn't put you on certain medications or creams. But there's other people who they just didn't have access to it. It's just really straightforward. They just didn't have access to it. And they couldn't afford it, and it's like expensive to go to a dermatologist. Everyone says it's go to a dermatologist, and it's like, first of all, it's like usually like a 3 to 6 month wait a lot of times, and then you go there and it's like maybe potentially like $200 or so. And then sometimes it's just like a combination of, or 1 or 2 of the creams that they're going to use. And you'll see them again 3 to 6 months later. And then you have to pay another, copay, and you have to do this whole process, which, okay, of course you should do that. If you have acne, severe acne, do it, all these things, you can afford it. There's a lot of people that live paycheck to paycheck, a lot of people that are pretty close to that, and it's like really unreasonable to expect that they should have just done that. Like, and it's so outrageous to me that people just they lack empathy, and they just have no understanding of what people are suffering from, and no understanding how, like, different demographics could suffer from things differently, because they just don't have access to care the same way you did, because you just happen to live in the right zip code. So it's, this whole process in this country is just outrageous when it comes to it. And they act like this is just a cosmetic issue. And think about that. How is it cosmetic when you have severe cystic acne, and then you have these scars that now it's causing severe mental anguish on you? And who could, like, when you're looking at this, of course it's going to cause like some anguish on you. People are thinking, oh, well, nobody's looking at it. And it's like, first of all, it's not even just necessarily about what other people are looking at, although people are looking at it a lot of times. It's just how you feel when you're looking at yourself. Like, if you look at yourself and like basically think that you're robbed of this stuff, you're robbed of like the best possible, your best possible face. It's like, you're not trying to change your face. You're not looking to do something else. All you're trying to do is look at the way you probably should have looked. And it's like, you feel like you're robbed of it. it's a very, very different feeling. Like anybody who's like was going about life normally and then suffered from a burn or from a scar or anything like that, they all know that there's like a point where everything shifts after that time. Everything's going fine. You just don't even like notice it, appreciate the fact that you have like, great skin, things like that. And suddenly, you get into a car accident or something else, like a shard goes into your face, and now your whole life has changed. And you just look at that and it's a reminder of it over and over and over again. And that's also kind of why I love like doing laser tattoo removal too. It's like sometimes it's like the story is really traumatic for people, and it's like it's nice to remove that. It's like you're removing trauma. I like removing trauma. I like that. I like the fact that I can remove trauma in people's faces. Zio Maria is saying, I've been to dermatologists who wouldn't even touch my face. Not just you, honestly, not just you. I myself, and interestingly enough, even when I was telling the dermatologist I was interested in the field, or I was like actually in med school, I would go to them. So I'm not saying all of them, not at all, but like I would go to these dermatologists sometimes. And it was like these top ones too. And I remember it was like very clearly this dermatologist at Northwestern. I was in med school and I was like really happy that I could just go to this dermatologist in Northwestern. I was assuming it was gonna be really good. She didn't even touch my skin. And she knew I was in med school, knew that like I cared a lot about this world and everything like that, and didn't even touch my skin. And I told this story before on here, people know, but like she would just like looking at her MA the entire time, looking at her computer the entire time, just like, and the thing is, she didn't even understand what was going through. I wanted to go on Accutane because my skin was super oily. I was getting still severe cystic breakouts. She was upset with me because I put myself back on doxycycline. I did it, because I knew that like I had to do something. I couldn't see the dermatologist on time. What was it? And when you think about it, when you actually think about it, what was I supposed to do? I had cystic acne. I couldn't get access to cure on time because she was just booked up. And so now, was I supposed to just sit there with cystic acne, or should I go to just get the prescription for doxycycline and try to clear it up so I don't end up getting severe scarring? And she was like, acting like I'm non-compliant. It's my first time meeting her. So literally, it's not just you who doesn't get touched by a dermatologist for your skin. And it's crazy and it's wild that this is acceptable. And I'm not just saying it's only dermatologists. Like when I was doing my hernia repair, the surgeon didn't even touch me. He didn't even touch me. He had, he knew I was a physician. I was just actually down the street from him, and didn't even touch my, until like the day of surgery. He's looking at it like it's on the left side, right? I'm like, no, it's on the right side. And then he's like, oh, that's right. And then like, the anesthesiologist is there and he's looking and he's like, oh, whoa, this is way worse than I expected. And then like, I'm like, out. That was the last thing I remember. And they probably thought I wouldn't remember it, but I remember it. I do remember him doing that. I remember him not like evaluating me properly, and then knowing right before I was going under that like this was way worse than he expected. That's great. Like he had his PA evaluate me, and he just like counted that as his evaluation. But and he knew I'm a physician down the street from him. So I can't even imagine for some people that are just not in the healthcare world and things like that, they're doing that to people like me. Now imagine like things like that for you guys. So I 100%, like I believe it. I 100% believe that you weren't evaluated appropriately, and it's unfortunate, really unfortunate. I'm so sorry that you suffer from those kind of scars. Really, honestly, it's really shocking that in this day and age it keeps on going over and over and over again. And, I know that a lot of doctors are worried about like AI taking their jobs, but like part of it's just like do better, honestly, with so many things like the antibiotic use and things like that, be like better and evaluate your patients better, do things like that. Yes. Sure. I don't want AI to take your job, but like also like maybe like it was time to like really step it up, honestly, too. Like AI wasn't going to actually feel your skin, feel people's skin. So maybe you should have been feeling people's skin and do that. Be better. A lot of providers don't know what they're doing when it comes to scars. Yeah, I mean, 100%. I don't disagree with that. A lot of people just push product and like they're pushing skincare products. Red flags, really. Here's some red flags. The physician you're going to is pushing a bunch of skincare products on you. Really, huge red flag. Physician you're going to, or whatever, the nurse provider or a PA is pushing. Then they're saying that instead of doing a retinoid, do something else for some other topical cream that they happen to sell, which is like expensive and it's like branded like either by themselves or something like this. And like that's suspicious. It's like I don't know why do you have to do it that way. Those are all like good questions to ask. And it's like, are they getting commissions for their sales for their products that they're pushing? Or like the staff getting commission, all that kind of thing. All good questions, like, and just things to wonder. And the fact that it got mixed up in the medical world is really concerning, honestly. The fact that all that stuff, like people are pushing all these products and stuff like that, and it's all like just a full commission model. And it's really, it's like, it should be alarming. Other red flags that, you go to somebody and you have scars, and I show you those like severe scars sometimes, and somebody's telling you to do microneedling, or they tell you to do something like, some other minimally invasive type of procedure for these scars. And they're trying to sell you a package, and they're insisting that like you'll only see improvement if you do 6 sessions. And then you're going to get like 70 to 80, 90%, something nonsense like that. It's like, that's a huge red flag. I never promise a percentage of improvement, never. And I do the most I probably do some of the most scars in the world. And I never promise a percentage. I will say, though, that after a certain point in time, it's going to be way less noticeable and visible to yourself and other people. Under harsh lighting, though, it's still going to be visible. So you just have to be realistic about that. I'm not sure what the percentage of that is. Everybody's percentage is different in their mind. So people that are pushing percentages don't understand how scars work, and they're using the wrong modality anyways to get the best possible results anyway. So, all that, like red flags. These are the things that like I think that you should start paying attention to. If you're doing an evaluation, or if you're you're on the table there and you're ready to do the procedure, and they're not even touching your skin, they're not evaluating your skin, they're not looking at every aspect of your skin and seeing the scars under angled lighting, then it's another red flag. Everybody knows, anybody with scars knows that scars shift and change with angled lighting. So you have to take a look and see the depth of the scars with angled lighting. If you're not doing that, it's just like it's another big red flag. And they're trying to make excuses for it, whatever the thing is that I could see it. No, you can't see it. There's just no way you could see it. There's just no way you could see those scars, the depth of the scars, without angled lighting. So I really want you to kind of really pay attention to that, because if you're doing these treatments and you're saying that you have to bring your own light or things like that for these people, it's just it's concerning. And like I understand that it's not everybody that could travel to me. I understand that, but at least pay attention to those things, because there is going to be a time when there's going to be more people that are going to be able to do these things. And I've told you before, I'm trying to keep this like pretty open source, that like, so things could evolve and get better and better and better in this world. And at some point it will get better and better, and all of us will get better and better, and it'll be awesome for everybody. So hopefully that day comes really soon, and you'll know that like this is the person that is at that certain level. Like this is a person that we could trust with that. And this is a person that they're trying to push, $3,000, $2,000 skincare products. It's a little questionable, because even though they're promising that you need these for your recovery, you need these in order to get the best results, I don't do that. And I think my results are pretty good. So it's like, I'm doing this with like just lotion and moisturizers. Yes, I use a pigmentation cream. That's one thing I require. But beyond that, I make it super simple without much, we're trying to make sure that you do not get robbed of your pocketbook, basically. I'm doing the procedure. That's the stuff I'm going to be focusing on. Really try to make sure that we can get optimal, best results with that. But my team doesn't get, some commission from products, anything like that. And I love that. I love that fact that we do that, and I love it. And it's like, I don't get, and I say it over and over, I'm unsponsored by everybody. I'm not, by anybody. I don't take a single dime from any of these companies. I don't even do these talks. I don't do anything for them. Nothing. I'd rather do talks to you guys. I'd rather just like have that, like my access is to you guys. And, there's physicians that could pop on here. They could get the talk from me this way, rather than me like getting paid by some company to do a talk. I really would. So it's like, I don't need the money. I'm great with money. I don't need it. What's the point of me like sitting there at a dinner or something like that and getting paid to present a certain viewpoint for the laser or whatever device or product or anything like that? It just doesn't make sense to me. I would much rather just like tell you openly and honestly. And sometimes things shift. Like it was good at one point and it's not great anymore. And now you're like stuck because you just were promoting it all day long. Lucky Singh is saying, hi, Dr. Qazi. Prior to a consult with you, can we send documentation outlining your history? Would there be a page limit? What is your wait time for out-of-country patients? Okay, great questions. So Lucky Singh is asking, can we send documentation outlining your history? Yes, I have some patients who send actually multiple pages of documentations because they've done that many treatments. And it's actually sad to see. One of my patients, I think I've double checked to see if he lets me share results, but his results is smoking. And he did 11 sessions before he came to me of something else. Like he had a whole sheet of things that he did. So you absolutely could do that. And so there's no page limit at all. And you could go through it with my team as well. They'll help you break down everything. What is your wait time for out-of-country patients? It varies. Right now about 3 months or so, but you could always double check to see if there's any cancellations and go on the wait list for that. So it varies for that. Payal Sharma is saying, hi, the procedure you do seems very harsh. Any other procedures like microneedling, does it help to resolve scar tissue? That's what I was talking about earlier, which is that it's not that it's, there's different variations of these treatments. We don't have to go as strong with as much energy for every single patient. It just depends on what's going on with people. Whatever is appropriate. But the recovery is actually not bad. It's like 4 to 7 days for most patients. 4 to 7 days is very doable, honestly. It's actually, I ended up doing, myself, I did like 6 sessions of Fraxel and microneedling. And my recovery every single time I was lifted, like somebody put my face on asphalt, and it was like that, and like it really, they would just use only topical numbing, which I think is terrible. That's why I only do nerve blocks. And it was just like Fraxel, like it was just like burning my skin, and did nothing for my scars too. So there's that. This is Mato saying, hi doctor, I've had 14 sessions of Fraxel and a few other lasers and $10,000 with no real change. This was done in Laguna about 10 years ago. I'll be happy to help you. This is Mato. I'll be happy to help you someday. That's what I do, a ton of that. That really is my whole thing, is that my goal is just to be the last stop for everybody. That's my whole thing. That you've done a ton, or you've thought about it a ton, and you've gone and you've saved a lot of money to basically come to someone like myself, and I'll be happy to help you at this point. That's what I want to do. I want to make sure that, this is the end. Sometimes the beginning for people too is like the beginning and the end. That's what I want. This is it. We're going to do this so well and so properly. And it's super important for me to do it that way. Like, it's so critically important for me just to like knock it out. Like when I'm doing it, I'm doing this. I'm like, this is like, M&M, one shot, one opportunity. That's the way I like it. It's just one shot, one opportunity. You do it. And especially I'm doing darker skin types. So it's like, it's very risky for me just to think about doing this over and over and over again at the same time. And it's like really risky, like doing like, invasive procedures like subcision or excisions and multiple times. Like just do it really well the first time. Sometimes, yes, you have to repeat some things, but like at least you could look back and like feel really comfortable and confident, look at the camera in the eye and really know that like you did this you did this at a very high level. You paid attention to this patient. You really made sure that you could push it. And it's like a really good feeling. It's really good. So, that's what I recommend, at least for whatever you're doing in life, just feel like that. Whatever you can find, do that. Mikey's saying a lot of providers just push lasers. There needs to be more education in the community. I think it's starting to get there, honestly. I do. A lot of people now are learning about TCA Cross. They're trying to learn how to do TCA Cross. And that's great. I'm glad. People should just try to get like more tools in their arsenal. But I'll tell you, and I tell everybody this though, the thing is that there's a lot of focus that's required. And it's not that people can't focus. I think that people misunderstand what like ADD is, and it's really just confusing for a lot of people. There's ways to actually, for people with ADD or anything else that they find that they have attention deficit, to really be very focused at certain things. It just takes a lot of energy to do that. And I think a lot of people actually just are that way, actually. It takes a lot of energy to do things exceptionally well. And unless you have that energy, unless you can really stay focused on things, it's really tough to actually kind of find other people to do certain things. That's why I try to focus on just a few things instead of a bunch of things, because it's like, how do you have the energy to be really, really good at a bunch of things? And if you're not really, really good at a bunch of like those things that you're offering, I don't know why you're offering it. Like I wouldn't offer it. If I'm not like, I'm just going to kill this every time I'm doing this. I'm just like super happy. I look at it. Like the other day I was doing filler on a gentleman. He's an old acne scar patient and he just wanted to like build out his jawline right now. On Friday I did it. And I was looking at it and it's like, he's like, what am I going to look like on Monday? I'm like, you're going to look dominant. You're going to look amazing. It's like, it was chiseled out. It looked amazing. And it's like, that's a really good feeling. That's why I do it. It's like, so I do a lot of like fillers and things like that because it just looks really cool. It's like, I look at that, it's like, that's like instantaneous. It's like a really, really great result, and just like built this out right now. And that's really fun and cool. So like, I don't do, like I said, I don't do everything, but like the things I do, it's like really, really fun. It's like, that's really interesting. I got that. That was really cool. Is erbium laser also ablative? Yeah. So there's different forms of ablative. Basically, there's fractionated ablative and there's full field ablative. And fractionated ablative is usually what you see on my page. You'll see where there's little dots there, and then there's like healthy tissue and healthy skin in between those dots. And essentially what ends up happening is that especially for darker skin types, you can have a faster healing time. But then there's also full field erbium where you don't see the gaps really. You'll just see it completely white over there. It's basically complete ablation of dehydration of the skin. And that works out really nicely for certain patients if you're trying to pick up more like texture, if you're trying to pick up some of the pigmentation as well, and you want to just try layer after layer of the skin, that could work out really well. I don't particularly love that for scars though. I don't really think that there's much value in doing that over a CO2 laser, to be honest with you. But I know some people would argue back and forth, and I'm open to it. Maybe it's just a matter of the device, things like that. But so far, I never really found it to be like anything that I was so wowed by or so impressed by. So that's why I never really pushed it, to be honest with you. It was more for, it's excellent for anti-aging though, like really good for anti-aging. So it's like, it picks up pigmentation really well, really like just gives you a really nice glow. But most patients that have scars don't necessarily just care just about like getting a glow. They're trying to fix their scars, right? So I don't really find it too helpful for that. Aries asking, best treatment for bad skin texture, doctor, thank you. So actually Erbium laser works really well for that. Erbium is really good. And yeah, for those who are just asking about Ziomara Marie, you guys should watch her video. Just watch it. It's actually did really, like, I got tagged a bunch of times with that, which by the way, I really appreciate everybody that tagged me. A lot of people were tagging me. And it was, I would say like a few things, like I was saying though, but it was amazing how supportive people are. And everyone thinks that like you're going through this alone, there's nobody else going through it. And it turns out there's a lot of people going through scars, a lot of people going through something that they're feeling uncomfortable about, acne, about pigmentation, just even volume loss. And it's distressing for them. They're just like, it doesn't look like them anymore. And it's pretty cool. It's pretty cool that, you have a community. Like I wish I had that when I was growing up. Like it would have been really helpful because, I've mentioned before, I'll mention again that like one of the biggest things, one of the best books I ever read, and the biggest takeaways I took from that book is something called The Origins of Totalitarianism. Really genius book, something by Hannah Arendt, Origins of Totalitarianism. And what it talks about is how loneliness causes totalitarianism, causes fascism, and particularly loneliness among men, actually, interestingly enough. So, a lot of interesting things within that book. It's a very, very long, book, but worth reading if you have the time, if you're interested in that kind of world. But I think it was, to me, it definitely affected my worldview because I felt that there was a lot of loneliness in the world, a lot more loneliness than people admit. They're so lonely they don't admit it. And, the loneliness kind of gets worse and worse because you just sort of sometimes don't hang out with the friends. And what happens though is that it's not just due to one thing. Sometimes it's due to like a few things, and then like acne or scars just tips it over the edge now. So if you could help like in one little area, help with that loneliness, help with the acne part, help with the scars part, help with the pigmentation part, things like that, that's pretty cool because now the rest of this, now they do hang out with their friends now. And then now maybe they're feeling like maybe they could get more connections again and they're not feeling as lonely anymore. And now you just sort of start chipping away at that issue. Which imagine in this day and age, if you can start chipping away at that issue, now you can see why it's a big deal, right? So pretty cool, right? Like if you think about that is an actual thing that a lot of people don't realize. They're sitting there in their own mind thinking that they have the worst skin, the worst scars, the worst acne, and you realize that there's a lot of people suffering from a lot of different things. And it's nice to actually have community of just like talking to people. One of the best ways to actually really defeat fascism really is just smaller communities and just like building that and just making it like just really supportive and just like it's really cool actually. It's you could actually then you smile more to each other and you realize that like you're not alone, and just feeling like you're not alone is kind of, it's going to chip away at a lot of things because there's a lot of hopelessness out there, not just in the scar world and the acne world, just out there. There's a lot of people who just feel hopeless. They look at all the stuff that's going on and just feel hopeless. How can I solve this? How can I do this? Nobody else cares as much as me. And it turns out there's a lot of people. And so I like it. If you look at her page, you'll see there's so many people who are supportive of her. And everybody tells you that like people are just evil. People are just selfish. People are just trying to manipulate you, blah, 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 blah. They're the ones that are trying to do that. And they want everybody else to think that. They all want that. They want everybody to be like that. It's amazing for them because it's like just proves their point. Hey, I was a sociopath. I ended up being a psychopath, and like I'm like I now end up enjoying like suffering because I get to make money off of it. And it's like, the whole world is like that. No, dude, the whole world isn't like that. You guys are the exception, and we're gonna cut you guys out of society. Or just be carved out with us. And in a way, you can kind of do that within this little world, because people in this world actually get it. And look at her page and you'll see that. You'll see what I mean. You'll see the comments on there. People in this world understand it. They understand what loneliness is, and they're empathetic towards other people who have loneliness. It's very interesting, actually. It's an interesting thing that actually is starting to shift. And some of these platforms have done that. We've gotten away from this influencer lifestyle type of thing where people are just showcasing their the fact that they have a six-pack and abs and they're doing this, they're like at the beach, all that kind of stuff. And that just looks so old now. It's like people crave just honesty, and look at her thing and just you can feel her emotions, and you'll see it, that it's and then see all the people that also suffer from that. Pretty cool. And you're not alone. You're not alone when you look at it. Christine saying, if you look at my timeline, I just fried my face CO2 off and it will destroy my fat pads now. Now, I doubt it's going to destroy your fat pads just like that. I mean, it's possible if someone really just kept on bulk heating an area. But first, just see what happens and kind of go through and, the healing process first before worrying about that. It's also possible that you had some volume loss due to scars, though, to be honest with you. Does vitamin C help PIE? It helps a little bit with it. It's not really my go-to for it, but it does help a little bit with that, though. What surgery did you have before with us, Christine? Triple X saying, does fully ablative CO2 laser give the best results due to the downtime? No, not necessarily. It could end up making things worse, actually, potentially. So it just depends. If it's really thick, those thick edges of the scars, then yes, it could help with that, but it may not be like the biggest solution, though, for that. PRP or PRF for under eyes. I use both. When I was first starting, I had somebody who came over to me and was insisting that PRF was like superior. And there was a physician that was like, I thought it was just like an independent physician. I was super naive. Like I came out of residency, everything like that, and just thinking everybody, like all physicians are just honest, like still, even though I had some experience myself with like kind of nuts physicians, but I was like still like very naive and thinking physicians are really good people like me. And this guy who's a doctor is like telling me to do PRF, and he doesn't really have much evidence for it, blah, 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 but he's saying it works really well. And so I'll just go buy this kit, and it was like more expensive, and it was like, I had to charge more for patients, all this stuff. And then I discovered that he was like being paid by the company, which he didn't disclose. And then later on, like I was just, kept on trying just regular PRP. And I realized that PRP was just like just as good as a PRF. So at least the way I was doing, I was like just as good. So what was the point of me doing this extra expense there? And I could just go as cheap or as inexpensive as possible with just PRP. Why are some acne scars very deep and cystic, or from acne very deep and cystic, while others are superficial? How do you avoid the cystic ones? Well, it really, it's a few things. I mean, there's a lot of times it's just, it's not necessarily that you're going to be able to avoid cystic versus, or these more superficial lesions, honestly. Those deep cystic ones, superficial ones, very difficult to kind of control that. Things you could do, though, diet really is a huge factor. In my day, it was like nobody ever talked about diet. They would just deny the fact that diet was ever related to acne. Just told you that there's no evidence and don't worry about your diet. Now we know better. We know that like things like dairy do factor into this. So like the easiest thing to cut out is dairy. So easy. So go, try that. So cut back on the dairy, and then of course you may have to be on something like an oral antibiotic, topical antibiotic, tretinoin, Accutane, Accurelaser, all options there. Let's see here. Can we do TCA Cross mixed with CO2 fractional laser for acne scars? Yes, we can. I missed a bunch of questions. Sorry, guys. I saw a bunch of those right over here. So I will follow up. So someone's asking, is there a way to confirm their provider is using the real Belafil and not something else or expired product? Honestly, I mean, I would say that's extremely, extremely unusual to have anybody do any product that is expired. Like, I don't know if anybody's ever, like, I've never heard of a case like that myself. People that are in the medical legal, they may know like of some cases here and there, but I think it was just extraordinary. There was a person that they arrested in New York City recently, an esthetician that was injecting Botox. I'm not sure how that whole thing got like escalated to an arrest just like that. But they arrested and they charged the person. Maybe it was because I think they were misrepresenting themselves too, but they charged for battery as well, as my understanding is at least. So this esthetician just got arrested for that. So I think it's probably a low likelihood of that being a concern, to be honest with you. Expired product, extremely low chance of that happening. Maybe if anybody in the chat has had that experience or knows about that, will let me know. But like, people are extremely careful with that stuff, at least in my mind. Even people that are like kind of sketchy with other stuff, I know that like they seem to be pretty careful with that kind of thing, because they know they can get in a lot of trouble with that. Let's see, a photo frame is saying, some dermatologists in Brazil use high concentration TCA for whole face scars. Is it safe for any skin type? I would definitely be really cautious and really concerned with darker skin types with any peel, any energy device. Really, it's I think you really could end up causing more problems, especially like hypopigmentation. Really big concern. Definitely with TCA would be more concerned with this PIH, and it could be like really long lasting, and I'd be really concerned with that. So not my way of doing things. I would go safer just to ultimately get to the best possible result. Oh, awesome. Christine saying did lipo and Renuvion last year. Awesome, Christine. Thanks for coming on. Appreciate you. Thank you. What sunscreen do you recommend? Zia Maria, I would recommend mostly like physical sunblocks for acne prone skin. And you know what? I had a whole thing a few weeks ago about the different kinds of sunscreens that that I say are pretty good for acne prone skin. But the easiest one to do, just like cheap over the counter, interestingly enough, is Neutrogena's, the newer one, which is like, it just has a high concentration of zinc oxide. It's tinted also, so it's actually kind of nice. It used to just be all only white, but it's easy, cheap, just something to consider. Every time I recommend a sunblock though, someone with acne would say that it was breaking them out. So I have to go back and kind of double check, because the things that I'm using now don't break me out. So I'll try to double check to see, well, maybe we'll do a poll again. How about everybody right now, what's your favorite sunscreen if you're acne prone skin that does not cause you to break out? Everybody put it in the chat. I'm going to read it out for everybody, and we'll determine what the best possible sunscreen is for acne prone skin. Because it's like, sometimes I say it's great, and then I try it and it was fine for me, and other people say it's breaking out. So I want to know actually. So Tutu's saying Innisfree. Someone else is saying Neutrogena. I found Neutrogena still was fine too. Viola, Hero Cosmetics sunscreen from Target. Awesome. Kula, Korean sunscreen. Which Korean sunscreen are you talking about? So a lot of Korean sunscreens have chemicals, which is okay, but like, I do sometimes wonder for acne prone skin, could it potentially irritate them? One thing, especially after laser, especially. Face Reality, Neutrogena, Clear Skin. So good. Okay, I'll take a look and kind of look at those, and maybe we'll like have all the team try it out and see what works out. I'm always interested in knowing what things are great for you guys too, because like it's okay for certain demographic, but then if people with acne prone skin, they're saying it'll be a problem. Supergoop, I did tell people before about Supergoop, but then I had some patients that said they tried it and then it caused some acne. So I was like, okay, I'm really trying to collect all that data, honestly. I'm working on it actually. Just slowly, you guys may be noticing actually sometimes on your intake forms too, I'm asking about the brands because I'm trying to put it all together to see which ones are out there. Sailor Moon saying, I love that you don't sell your own brands like and everyone else. I appreciate you, Sailor Moon. There's just a lot of stuff that's out there. It's like, I'd rather just like work on the things I could do really, really well. And that's like with my own hands and building with my own hands. That's like way more fun to me. That's what I do. Is there a laser treatment that helps dissolve Sculptra faster? I think radiofrequency microneedling could help. I had a patient, kind of interesting enough and unfortunate. She went to a flea market actually, and somebody injected Sculptra in the flea market. It was I checked on the ultrasound. It was Sculptra actually. I did have the appearance of Sculptra, I ended up doing steroid as well as radiofrequency microneedling a few times actually, and it helped a ton for it. But then there was a lot of laxity afterwards underneath the skin. So she still, needed surgery for tightening the skin. So I did try with radiofrequency microneedling, some steroid injections. So that may be what you, can consider, but there may not be much of a choice other than just waiting it out. And I'm not sure what phase you're in right now, but you could just try massaging it. Sometimes just massages the health actually. Let's see, Azula saying, is it true that filler doesn't dissolve? Considered it for my scars, but worried about pillow face. Well, if you're doing it really just in the scarred areas, you're really going to have low likelihood of having that pillow face effect. It's really when they try to do a lot more, they're using too thick of a product that you'll run into problems. But I usually use more collagen-based products like Bellafill. I use Sculptra, Radies. Those are typically what I end up doing. can you avoid the purge phase with low dose Accutane, and will it help improve scars? Yeah, you could avoid it by taking zinc. Actually, also take Claritin, and then moisturize a lot, and make sure you're not using any other exfoliants, nothing. You're just going to use a moisturizer like Vanity Cream. You're using sunblock, like we were talking about. That's why we just went through all these sunblocks. Actually, it looks like Supergoop won. A lot of people down here were saying Supergoop. So interestingly enough, I'll pay attention to maybe the one I told the patient to use, and then she ended up getting a breakup. Maybe it was just a fluke for that. But a lot of people are saying that. So interesting enough. But yeah, so I forgot where I was actually. Oh, about the purge phase. So yes, I would usually just use like a physical sunblock for acne prone skin, and then Vanity Cream, and then just that. No exfoliant while you're on Accutane. Let's see here. Can a microfat transfer helps lift a sunken scar after excision gone wrong? Potentially. So fat will help support that area for sure, but doesn't do as much lifting. So it may not last as long in small pockets like that. So maybe you would do something else like a Belafol potentially, but it may not be the best option there. Aries saying, I would totally be your first customer if you would come out with a serum like Retin-A without irritation. Well, you can mix it with a moisturizer, and that's great. Actually works out really well. The only thing is it just doesn't last as long that way. So there's plus and minuses. Thanks for answering, G. Appreciate you. Yes, you're right. I recommend excision first and then fat transfer later. Hi, Kimmy. Good seeing you on, by the way. Thanks for coming on. Let's see here. Is the widening of scar not sure or if it's okay? Let's see here. Queso saying, is the widening of the scar not sure if it's getting shallower, a normal thing after resurfacing laser? A lot of times, what's happening there is after resurfacing, your skin's very, very dry, and then the oil production now ends up actually making it seem as if your scars are a little bit wider. So controlling your oil is actually really important. So sometimes actually a very, very low dose microdosing of Accutane could actually help out if it's kind of prolonged like that widening there. This is Moto saying, I gave up years ago, then came across Taylor Liberator Technique and TCA a few years ago. Then came across you. I need subcision, TCA, then laser, 35 years old now, moved from Laguna Hills to Bakersfield a few years ago. Look forward to seeing you. I'm really happy to help you out. I have a lot of patients in the Bakersfield area. You're asking what my ballpark estimate is. So most patients spend about $5,000 to $7,000 for scars. You said subcision. So you said you're assuming that you need Taylor Liberator subcision. Maybe you do or don't. I'm not sure. You need TCA and you need laser. So that's really going to be closer to that $5,000 to $7,000 range there with that combination there. I'm up. Good seeing you on, by the way. Again, I forgot to say hi to you earlier. Saying you came in, what was that, Monday or so? I don't like sunscreens that make it look like you have makeup on. For girls, it's beneficial, but not for guys. You know, honestly, in the acne and the scar world, it doesn't matter too much. I don't know if you have like tinted sunblock, things like that. Like, don't worry about it, honestly. Do whatever looks better for your skin. You know, there's a lot of people out there that are doing a lot of things to cover up their skin, and it's like if you feel like you need to wear tinted sunblock, just go for it. Like, don't worry so much about like what's male and female with that kind of stuff. If it's just like, you know, wear tinted sunblock if it looks good on you. Don't worry about it. But like there are, you know, of course, like clear sunblocks. You know, there's I would probably not recommend the white ones, but there's clear ones also. Mesoaesthetic has a nice one that's clear. And even though it's a little bit oily, it doesn't actually tend to break out any of my acne-prone skin patients. So, you know, that could be an idea. So, mesoaesthetic one has a clear one though. But like I said, honestly, don't worry so much about it. Really, there's a lot of people that you know, think a lot about different things. You don't have to worry about so much about their opinion about something. You know, it's just like whatever. And it's like I think there should be like more people that are open about the fact that you know, guys can't cover up and things like that. And it's okay, you know, it's like, you know, if they're wearing the tinted sunblock to make themselves feel better because they have redness or like acne and things like that, like, okay, you know, maybe it makes them feel better. And like, you know, who cares? As long as it's not dehydrating their skin too much, like sometimes makeup dehydrates the skin and that makes that's worse. But as long as it's not doing that, like, don't worry so much about what they're doing. Triple X is saying, does dehydrated skin make scars appear worse along with angled lighting? Yes, that's correct. But oily skin, basically dehydrated skin can sometimes lead to oil production, to excess oil production. That can make it look a little bit wider. Does one have to complete the cure laser treatments within a specific timeline? I mean, vast majority of patients do it really within those 3 months. I'm not sure if there's really, you know, I've had some patients that done it, spread it out a little bit more. And they still have good results, but like, I'm not sure if like, I have enough data to be able to say one way or another, to be totally honest with you, to say if that's all you need. Kim is saying tinted sunblock is the only thing working for me. I'm using color science and it blends into my skin perfectly. You're like, multiple people have said the color science. So I think I tried that. I don't know, for some reason I thought maybe I tried the white version actually. I think I tried the white one and there was like a white cast. So that was the one thing with that. Maybe, I don't remember. I did this several months ago. I like had a bunch on my hand even. I was testing to see with my skin tone which ones work well. But I'll do it again actually. Thanks so much, Belladora. Good seeing you on. Best treatment for hyperpigmentation in a quick way, any lasers? Well, it's not really going to be quick. That's the thing with hyperpigmentation. You have to go really slow with hyperpigmentation. So big thing with me, pretty much all my treatments are about patience. So big thing. Really have to be patient. With skin restoration, it's about patience. And if you're not patient, you really have to wait to do these things until you become patient, because one day maybe we'll become patient. Maybe at like 20 years old, when I was like 20, 21, I probably wasn't patient. But like one day, like I ended up becoming really patient. And so like, it made a lot of sense. It's like, be really like, go when you're, when you're ready to be patient, because it's going to be slow. It's going to be like, you have to like more resolve than you may expect to, but like, if you're in that position, then of course I'm going to be here for you and I'm going to like do it, like kill it and knock it out of the park for you. But like, have patience though, because it's going to be slower than you expect. Almost everything really with this, you just like, in order to do it safely, in order to do it really effectively, you gotta go slow. Photo Farm is saying Q-switch didn't work, but CO2 plain laser did for the pigmentation. Well, if it was like relatively superficial and the right skin type, then yes, that could be an idea. Q-switch may just need more sessions possibly. And sometimes there's a bit of rebound pigmentation, but that can happen with all of those though. Well, going to bed, thanks for all the info. I appreciate you telling me, Manny. And I have a lot of patients that say that they're listening right before bed, and they like picked up a few different tips for things that were like decisions that they had to make, like even the next day, like they were supposed to go and do a deposit or do a consultation or something like that, and now they knew what to say to and ask the right questions, which is awesome. So hopefully that helps out. Is there an equivalent to Belafil? I don't think it's available in Australia. No, it's not available in Australia. You could do essentially Sculptra or Radius. Those are pretty much the things. Zia Maria is saying that she needs a routine. Okay, so the things to do is control oil production. So you can control oil production with a topical retinoid. So something like initially to start out with would be like 0.025 tretinoin. Okay, so that's a good starting point. You have very, very deep ice pick scars, a lot of volume loss, but those scars get accentuated with oil production, and you have a little bit of oil production there. So that's number one. Number two, you could do, especially since you're a woman, you could go talk to your GP or your OB-GYN, dermatologist. Really, any physician will be able to handle it with considered something like oral spironolactone. Excellent medication. It could hopefully help out more with that oil production, stimulate a little bit of collagen, also prevent sometimes during your menstrual period, you may have a surge of oil production during that time. You may have more acne during that time. So it'll help prevent that from happening. So that's going to be really useful for you. And then of course, a really strong sunblock, so there's less chance of pigmentation, but there is a little bit of pigmentation right now. So just something over the counter you could do is Eucerin anti-pigment cream. Actually, it's like totally underutilized. They have a patent on it, Thiamidol, this patent that who knows when they'll release it. It's a good product though. And it's cheap over the counter. I think it's like $30, $40, and use that. And it'll take like some time to lighten up some of those hyperpigmented marks, but do that and you'll see some improvement with it, because the pigmentation does make the scars look a little bit worse. And I'm not saying, of course, like, as you know, I know that you have very severe scars. That's what you said in the video. And you have very, very, you do have that, but you have oil production, you have other things. And so if we can control those aspects in your hands right now, that'll be awesome. And by the way, I'll be happy to help you out. I know so many people tag me. I'll be happy to help you out actually with your scars, and it'll be like my pleasure. I think it's gonna be a very complex case. It's gonna take a long, long time for your kind of scars. And I wish I could share her video. I don't know how to share things on this thing like that are on social media, but you guys just click on her page and see it. It's like this really great video that she has showcasing her scars, and you should click it and see. And for those kind of scars, we're looking at like a few years worth of work, to be honest with you. It's going to take a while. And it's going to be like this process where we will, initially go pretty much within very safe limits with energy devices if we were to use them, to just see how your skin's going to heal. So we go through that, and then we could be able to tell, over time, if we could push it a little bit more, if we could do other things. I saw a lot of people were saying for Zio Maria about doing a Phenol peel. It's like, very severe scars. Could we do Phenol peel with her? She's just added an estimate, and hopefully it's okay. I'm assuming it's okay for me to talk about, your skin type on the live, but is it okay for me to talk about that? Hopefully it's okay for me to kind of go through like your skin type and like just over skin. I'm assuming because you had like a lot of viewers on there, and like hundreds or thousands of people were like commenting on and like tagging me into this thing. So I was like, okay, yeah. So I appreciate you saying that I could do it, because like I assumed it was, but I just want to make sure. But yeah, I mean, with your skin type, which is probably like Fitz 5, I'm assuming Fitz 5. But if it may even, sometimes be needed to be treated as if it's Fitz 6. So you have you're at high risk of hypopigmentation. And it's something we have to really, really think about, so we'll have a conversation about it at some point, but we definitely have to sit down and think about that, because there's with anything that we're doing, with energy devices, with peels, anything could cause hypopigmentation, and that's loss of pigmentation. But there's some people that like their scars are so severe that it's like, okay, let's weigh some of those, that risk, and see if it's worth it for us. And does it make sense? Like, is it really going to happen? Low likelihood of it happening. If it does happen, it could be, just a temporary type of effect, but it also could possibly be like permanent in a very, very few rare cases. And that's really important to know. And we have to really have like a proper conversation where people just think about that. Like, I know I have a lot of people that ask me that Fitz 5 and Fitz 6, and they want to do something really aggressive. And it's like, let's really think about this. A lot of times I talk them out of it, because we could get there still, it just takes a little bit longer, but we could get to pretty close to that with a slower, just a safer way of doing it, just lower energy a few times and doing it like just a few different combinations of treatments, rather than just doing a very aggressive treatment off the bat. So what I would be inclined to do would be more like lower energy form of the laser, probably like physical things like excisions, a TCA Cross, subcision, some volume replacement. And then over the course of several times of doing that, eventually as it gets more superficial, then we could think about maybe doing something a little bit more aggressive for certain parts of the scar, or maybe your skin's now, because it's so superficial, I don't have to go as deep as I would have a year and a half, 2 years ago. So that would be like the way I tend to try to approach it for darker skin types. It's like, I really do want to have it where I'm trying to get you excellent results. I'm trying to pay attention. I know you're traveling from far away, things like that. But I really, like, for all my patients, I have patients from Germany, patients from Australia, patients from New Zealand. And it's like, I want to make sure like I get an excellent result. But sometimes most of my patients are also darker skin type, so I got to be very, very, very careful still at the same time. So it's like exactly like this balancing act right there, and really important that I just follow along with that balancing act. And so it's like, yeah. And between that, I'm like, between those two, like the result versus safety, I'm always just gonna choose that safety aspect there. So it's like it always ends up winning. And really, it's I know that sometimes it could take a long time that people may expect, but like that's the best possible way, because we don't have to run into problems with pigmentation that would be a little bit worse than scars for some people. That's what I think, at least. And that's why I try to clear up pigmentation very, very quick for patients. As long as you're wearing sunblock, as long as you're following my instructions, it's like really very, very mild. I mean, there's so many of my patients are on right now tonight, and not a single one of those kind of think of has like, and I've done treatments on them just like a month or two ago, and not a single one of those I think has pigmentation at this point, which is awesome. You do Phenol peel, isn't it banned now? No, it's not banned. It's not banned in America. It was banned in Brazil because someone died with it. It's not to be taken lightly. I do an EKG, I do blood work before I do it. And I do it with an anesthesiologist, and I do, like, I don't know almost anybody who does it that way. And I know it increases the cost. I'm fully aware of that, but at the same time, it's like, it has to be safe. And so it's like it's a risky peel. And there's no way of managing the pain and watching the EKG, and also doing the peel in a timely manner, because you have to do the peel within certain quadrants within a certain period of time. If you do it too long in certain areas, it could be toxic to the heart. So, we have to be really careful with that as well. And so how are you doing that, managing the peel and then also managing the heart and also managing the pain? It's just not possible. So like anybody who's like, trying to say you can just do it for a few $100s, you're doing this, you're doing that. It's just so it's so reckless, not dishonest. Just like maybe they are doing that. I think it's more concerning. It's just reckless. It's just like very, very cavalier. And you don't really have a full understanding of medicine. My sister died from ventricular tachycardia. It was a preventable thing that happened to her. And it's like 100% I'm going to prevent something like that happening for my patients. I never want anybody to go through what I went through. So it's like, just like I never want that to happen. And so it's, super important to me that things are done very, very safely. And that's why I make sure that, when I'm doing these treatments, it's like, I'm the only, I don't know anybody in the field, it's certainly not standard of care. They'll say, this is not standard of care. I check the heart rate before I do any procedure for lasers, any scar treatments. I check the blood pressure and the heart rate. I've caught actually, like yesterday I had a patient, his heart rate was in the 130s. He was so nervous, he was in the 130s. And, and now you could get a little bit more anxiety. That was even before I even touched him. And we caught that before we even did the procedure. So, I've caught, a patient that like the blood pressure was sky high. And so interesting, it's like that's how we could stay safe actually. But amazingly, it's not standard of care. People don't really recognize that these things are happening. So yeah, the heart, the heart does need to be protected and monitored at all times. Really, it really does. I appreciate everybody that's giving condolences. I appreciate you. And really that's, for me, it was crazy because I saved so many people with ventricular tachycardia. I had so many people I had a guy that was like a weightlifter that drank a bunch of energy drinks, and we had to shock him out of his rhythm. And it's just like that stuff. I did so many times. I saved so many people from ventricular tachycardia. And I know there's a bunch of healthcare workers on here right now. I see their names. I'm sure a lot of you guys have too. It's like life or death within a few minutes, and so it's terrible. It's like it's a terrible situation that just a few moments there you could have actually saved, and you have saved other people, and it didn't happen to your sister. So the last thing I can allow is that to happen for anybody under my care. It's just I was the kind of person, our intern year, I was like the first or second week, we coded someone almost the entire shift. So almost the full 12 hours we did that. It was like a 22-year-old and we just she had, it was just after delivery, we just we wanted her to live. She actually didn't make it though. We kept her going for our shift, and then the next shift she died. It was really terrible, but I I'll do whatever I had to do to pull it through for my end. It's I can't be responsible from other doctors, other things. I wish that a lot of doctors would be better, honestly. I wish a lot of medicine was better. It's tragic to me that it's not, but that's where we are in this country. It just got worse and worse and worse decade and decade ago. After a lot of people just just practice really poor medicine, and they're worried about AI. But man, just be better. It's touch patients. You saw so many people on here were saying that their physicians don't touch them. So it's a real thing. It really is. What was my sister's cause of death? So she had initially ventricular tachycardia, then they tried shock, so basically she had sudden cardiac arrest, and then they didn't actually do CPR in time. She was actually at a restaurant, and she was found down near the restroom, and so there was a big delay when they found her. And then when the person did find her, they screamed and they ran to go find some help and things like that. But really, that was probably 7 minutes into it. Still was a chance probably of doing CPR at that point. So CPR is super critically important, especially for this first couple minutes. Obviously anytime, if you do it immediately, that's tissue perfusion. And, but the fact that that more people had to come by and then figure out what was going on. And then they started CPR, and now you're starting maybe another 5 minutes after that. And now it's something that was savable and preventable, didn't become that way. And then they checked on the monitor and showing ventricular tachycardia. And I was told that it was ventricular tachycardia. I was okay, well, this is, solvable. I solved that many, many times in my career, in my life, ventricular tachycardia. There's still hope that she's going to be okay. But they just kept on shocking, and it was just that was it. So anyways, that's why I never plan on ever allowing that in my practice. That's all I was referring to. And really, I don't want anybody to go through that. And that's why, like, everybody, like, that says, you know, things that, like, you know, I get, like, it's really sad and unfortunate when people just don't recognize, like, you know, how amazing life is, you know. And so it's just like, I do take it seriously when people get very, very depressed and, like, you know, teenagers, things like that. It's like, I take it very, very seriously. It's like, I never want anything to ever happen to anybody, because it's like, no matter what the cause is, it's terrible. Oh, Ari, I'm sorry to hear that. Sorry. Yeah, that's just Ari. Yeah, I'm so sorry that you just lost your brother. Yeah, there's just actually, it turns out there's a lot more people than you may think, actually, too. When I was actually, you know, I announced this a few years ago when she died, that, like, I put it up there because I had to cancel a bunch of patients. And there's so many patients, so many regular patients who, like, told me that their sibling died. And it was like, suddenly became like this, like, little club that we had that, interestingly enough, a lot more people had that, a lot more people. And it was like, you know, everybody's experience is different, but, like, it was interesting that, like, they never told me, and, like, we just kind of now understood each other in a different way. So I get you, Eric. I'm so sorry that you're going through that. I'm really sorry. That's really terrible. And thank you for letting us know, though. You know, some point, you know, we'll go through it, but, like, it's a terrible sensation to lose a sibling. It really is. And